You're very welcome to today's update. It's Monday the 22nd of February. Now, the first thing I want to look at is a new report from UK data coming out of Scotland that shows hospitalisations are down 84% after one injection of vaccine. So I want to look at that in a bit of detail. And remember, this follows on data from Israel that we looked at a few days ago, showing the efficacy in preventing new infections, in preventing new cases after one dose of Pfizer vaccine is down 91%. So basically this works out as two pieces of data now showing very high efficacy in terms of reducing new cases and in terms of reducing hospitalisation after a single dose of vaccine. Now, these studies don't comment on the longevity. From Israel, we know that the immunity is lasting for 9 or 10 weeks now, and we expect it to go on for longer. But of course, we don't have more data because it hasn't been more than 9 or 10 weeks since the vaccine programme started. But this really is strong support for this one vaccine dose followed by a 3-month delay strategy. And other countries, such as the United States, really need to consider this as well, as we've considered in a recent video. But let's go and look at this Scottish... later on today we've got a special report from Australia and some other interesting things I can't quite remember. But let's make a start now. So early assessment of COVID-19, epidemiology and vaccine, antiviral effectiveness. So this is the EAVE study. So early assessment, vaccine effectiveness. So this is this study. Now it's from the UK Research and Innovation Council. Lots of references for it. The preprint, actually, I couldn't find this morning. I'm not sure the preprint's out yet. I'm expecting it to be out today, and the peer-reviewed article, of course, is going to take some time longer to come out for the peer review process to go through. But we've got good reports on this already. Public Health is Scotland. Now, they've got a data set covering the population of Scotland, 5.4 million, so pretty good sample size. And they've got a unique reference number for every individual, and this means they can link all their data sets to construct electronic cohorts. So what they've been able to do is construct an electronic cohort of basically all the patients that have been vaccinated in Scotland versus all the patients that haven't been vaccinated in Scotland. All done electronically because they have this sort of link-up system. So quite impressive, really. It's an example of sort of mega data, I think you would call this, big scale data. And this study relates to 1.2 million individuals, so good sample size, 22% of the whole population, and it's what you call safe haven data. What this means is you can get the data, but you can't relate it back to any individual. So fantastic way of collecting huge amounts of accurate data. Now, 4 weeks after the first dose, reduced risk of hospitalisations. Now, this was vaccines carried out in Scotland from the 8th of December to the 15th of February. And in that time, they gave well over 1 million vaccine doses, 1.14 million vaccine doses, 21% of the Scottish population vaccinated. So it's not a clinical trial, of course. This is happening, but it's basically a huge trial because they've been able to collect all of this data. It's part of the ongoing analysis, and this is something to mention to any of your friends who are still hesitant about taking the vaccine. That it's not just the clinical trials. Forget it. It's ongoing data on a daily basis that's still being collected, still being accumulated, still being analysed. Now, the Pfizer vaccine was based on a sample size of 650,000, and there was an 84% reduction in hospitalisation. The Oxford-AstraZeneca vaccine, based on a sample size of nearly 500,000, 490,000, hospitalisations were down 94%. Now, I'm very happy with the hospital reduction of 84%. I'm even happier with the hospital reduction of 94%. Now, we knew, to be fair, we knew this was going to be good because from the phase 3 trial data, we knew that basically no one was getting sick enough to be hospitalised. So it's not 100%, but it's a massive improvement. So one dose of Pfizer vaccine reduces hospitalisations by 84%. One dose of Oxford-AstraZeneca vaccine reduces hospitalisations by 94%. This is just Absolutely incredible. But of course, this is waiting for 3 weeks after the first dose. This is data collected in the 4th week. Vital to stress that. 4th week. The first 2 weeks, as far as we know, it makes no difference at all. So this is after 3 full weeks have passed, we get these marvellous reductions in hospitalisations. Having said that, it's important that people that have been vaccinated, who if you've had the Pfizer vaccine 4 weeks ago, you know your hospital risks are down 84%. If you've had the Oxford-AstraZeneca, you know your hospital risks are down 94%. But we know that that mustn't change your behaviour. So I've been vaccinated, but my behaviour stays exactly the same. Must be the motto. So remarkably good news from a very large sample size. Combined reduction in the over 80s came out to 81%, because of course remember these figures here, that these was just the over 70s that were vaccinated in this kind of time period. So these are in the most vulnerable groups. Pfizer down 84%, Oxford-AstraZeneca down 94% in the most vulnerable groups. When we get round to vaccinating people in their 20s, then we'll expect the hospitalisations, of course, to be massively, massively down, even on these figures. So there you go. We've got good data now from Israel that shows that the number of new infections are down over 90%. Good data based on 500,000 cases in Israel. We've got well over 1 million cases now from Scotland, indicating around about a 90% reduction in hospitalisations after 1 dose. And this is a resounding endorsement of the 1-dose strategy that we're using in the UK, and really means that other countries need to urgently consider this, because this is UK data, this is Israeli data, but it applies. No reason to think that this won't apply everywhere that the vaccines are given. Now, I think we'll get a report from Nigel now on we've got more stuff to come from the UK, but I'm going to go to a report now from Nigel, who's a doctor himself in Australia. So, Nigel, thank you for coming back on the whatever this is, the video, and please.
Well, welcome from the sunny climes of Perth in Western Australia, and a quick update on the vaccination program within Australia. Here in Western Australia, this is now Monday the 22nd of February, and we have started our vaccination program at long last, with the first 2 people receiving it being nurses in hotel quarantine workers. They were the first ones to receive it. Yesterday on Sunday, the 21st, 20 people over East were the first to receive the vaccine. The first person being an 84-year-old aged care person, and the 12th person was our Prime Minister, Scott Morrison. Personally, I would have liked to have seen him not have it, rather, and let an aged care person or worker have the vaccination. But he said it was more to reassure the public rather than him just trying to get ahead of the place. So a few things. Australia a week or so ago received 142,000 doses of the Pfizer-BioNTech vaccination, and we are making in Melbourne at the CSL, Commonwealth Serum Laboratories, making approximately 53 million doses of the AstraZeneca vaccine, and that is what the majority of Australians will get. At the moment, that rollout won't start until March sometime. Not sure when, haven't heard exactly. So the actual schedule with the Pfizer-BioNTech is it will be 21 days apart. The AstraZeneca Oxford vaccine will be 12 weeks apart, the 2 doses. and the majority of people are going to get that one. And obviously, once you've had the vaccination, you must still continue with your preventative measures. If you have to wear a mask, you wear a mask. Hand washing, distancing, ventilation, and so on, because you're not immune for at least 2, maybe 3 weeks. Then what we have here, if I just read this off my screen, the basic rollout in Australia is going to be in 3 phases. Phase 1, 1A, 1B, Phase 2, 2A, 2B, and Phase 3. So Phase 1A, which will require approximately 1.4 million doses, will be all quarantine and border workers, frontline healthcare workers, aged care and disability staff, and aged care and disability care residents. Phase 1B is another 14.8 million doses, which is the elderly adults aged 80 and over, followed by elderly adults aged 70 to 79, other healthcare workers, Aboriginal and Torres Strait Island people aged over 55, younger adults with an underlying medical condition, including those with a disability, and critical and high-risk workers, including the defence, police, fire and emergency services, and meat processing workers. Then we move into Phase 2A, which will require 15.8 million doses. That will be adults aged 60 to 69, and I'm in the top bracket there, so that's my group. Then adults aged 50 to 59, Aboriginal and Torres Strait Island people aged 18 to 54, and other high care critical workers. It hasn't actually specified that. Phase 2B, another 16 million doses, will be the balance of the adult population and catching up any unvaccinated previous people. Phase 3, which will come in much later, which will require another 13.6 million doses, and that's for those aged under 18 if it's recommended. And obviously there's still some debate going on regarding that. So that's the basic plan for the outline of the schedule for Australia. It tends to follow, I think, the majority of other countries. It sounds like it's similar in the UK and America. The elderly, those at risk, aged care people, frontline workers getting it first. And I think that's probably the right way to go. I'm down the list a little bit in Group 2A, so I'll just wait my turn and get the AstraZeneca vaccine. So that's it from Perth. It's currently 35 to 37 degrees centigrade here, so it's a nice warm day. So thanks very much, and keep up your good work, John. Well, welcome,
Nigel. That's just a great report as always. Thank you very much for that. I'm just making sure I'm recording again now because my capacity to mess this up is significant, but I think I'm back on now. Obviously, I think we agree on everything there, Nigel. I mean, everything you've said there makes perfect sense. Australia is basically following the same protocol. 3-month gap between the Oxford-AstraZeneca vaccine. Interesting. So good that Melbourne can produce 53 million doses of the vaccine. Absolutely brilliant vaccine producing capacity within the country. Every country needs to do this now. Mr. Morrison being the 12th person to have the vaccine, I'm with you on this one. I mean, I can see it both ways. I'm sure everyone can see it both ways. I know Boris Johnson in my country, he'd had the infection and he was umming and ahhing as to whether to get the vaccine early. But all the politicians decided no, they would get it on schedule, the same as the hoi polloi like me. I was lucky I got one that was just available at the end of a session a few days ago, so I've been very fortunate. But I wasn't due to get done next month, but that was just my own surgery being on the ball, so I'm fortunate. But I agree. I'm not with politicians taking it early. It's just not a good look. I agree. So thank you for Nigel. Really appreciate that report. 36 to 39 degrees in Perth. Here it's not. Having said that, it's actually not too bad at the moment. I think we're probably up to about 12 or something. Anyway, back to business. UK easing of restrictions. Schools look like they're opening on the 8th of March. 6 people from 2 households should be able to meet. Care home residents can have 1 regular visitor. Outside of area travel probably from the 29th of March. So these are all the UK easing. Now, the Prime Minister is, what time is it now? It must be about 2 o'clock now. But the Prime Minister's coming on in about an hour's time to go through this in detail. And so basically he's going to ease restrictions a bit. And then there's going to be a 5-week gap. Look at it again. So the approach is very very conservative, really, with a small c, of course, and we believe that the opposition parties are on board with this as well. So certainly the Labour Party are on board with it. So 5-week gap and then review it. So going down really cautiously. We want this to be the last lockdown. And I believe it will, because it's being coordinated in ways I'm about to show you. So 4 conditions before, so 5 weeks and 4 conditions before the next bit. Vaccine programme continues to go to plan, point 1, of course. Vaccine reduced hospitalisations and deaths. We've just had data that we've just looked at earlier in this video that this is happening now, so that's good. Infection rates do not risk a surge in hospitalisation admission, that's the 3rd point. And the 4th point is new variants don't mess everything up, as they could, but I don't think they will. So a phased report, a phased reopening from the UK government does make sense. 4 tests are currently being met. With the reduced restrictions, will they be met in 5 weeks' time is the question. So this strategy does seem to make sense. So good to see that there's criteria there. Good to see that there's no more dates. This will be titrated with the data. This will be titrated with the effect. But as the vaccines continue to increase, with this really encouraging data from Israel, this really encouraging data from Scotland, I am becoming more optimistic. Having said that, we're still quite high levels of cases. Now, I'm just going to... the cases are still going down, but the rapid drop is slowing down. So while cases are still going down in the UK, they're not going down as rapidly as they were. And this is data from the COVID symptom tracker app. Data from February 19th, 2021, peak of 69,000 cases. So amazing, nearly 70,000 new cases a day on the 1st of January. Wow. Based on data from now, this study, so that's history. This that we're talking about now is based on nearly 15,000 tests, over 1 million people reporting, and from this high level, cases are now down by 80%. Impressive. But the reduction in numbers is decelerating. The cases are still going down, but they're not going down as quickly. And Tim Spector's group illustrate this. Current prevalence is 1 in 294 people in the UK currently have symptomatic COVID. So down quite a bit. Of course, we need to add 20% or 30% to that because this is only the symptomatic cases. But having enjoyed a really, really rapid reduction in January and into February, now we are going down much more slowly. So the overall R number, the reproductive number in the UK is 0.9. And in Wales and Scotland, slightly higher, probably at 1, which means that cases actually aren't going down at the moment in Wales and Scotland. Now, we know hospitalisations are going down dramatically from the data we've just seen. So it's less important in a sense than it was, but we still need to get rid of this thing. So we still need to proceed cautiously. And these 4 criteria that the government are setting out do make sense. But schools going back inevitably, in my view, is going to increase the R number to some extent. But given that is happening, it really does show the importance of getting the vaccine out to protect as many people from hospitalisation and death as possible. So if we draw ourselves kind of our own little graph, cases have been going down quite dramatically, but now they're not going down as quickly. Not saying they've quite levelled off. The R value is not quite one for the UK, going down at 0.9, but not going down as quickly as it did, if that's cases. Going up there, and that's time along there. So the slowdown, it would have been nice if it just carried on going down as quick, but it's not. But to tell you the truth, this isn't surprising. This isn't surprising that they've slowed down a bit, because there's always going to be some community transmission going on as long as this virus is around. So it's not surprising it's slowed down. Highest rates at the moment in the... just shows we've got to keep working at it, of course. Highest rates in the UK at the moment, particular areas, Lancashire, Blackpool, Blackburn and Darwin, slightly higher than the average. Manchester, slightly higher than the average. Liverpool City region, actually not too bad, above the average there. Cases are rising in the 20 to 39-year-old age group. Cases are falling in the 60-plus age group. So... looks like the restrictive measures aren't being followed as well by the younger age group from this data. So there we are. That's a quick resume of the UK at the moment. Remember, this vaccine data applies to everywhere, as far as I can see. That's the vaccine is being rolled out, and it's showing very good levels of protection against new cases from the Israeli data. Now, very good levels of protection. 84 and 94% against severe illness and hospitalisation after one dose. This is after one dose, remember, but waiting 3 weeks for that dose to take effect. So it looks like to me that countries that are still at risk from increasing cases, such as all of Europe, such as the United States, should seriously consider going on to this one dose followed by a 3-month gap strategy, so that we can vaccinate as many vulnerable people as possible. Until then, these vulnerable people are still completely unprotected, which is really quite a sobering thought. So, thank you for watching, of course, as always.